views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hello, and welcome to Open BXRx, BronxNet's special coverage providing you the latest information, resources, services, and community efforts taking place locally here in the Bronx and virtually during the pandemic. I'm your host, Jericho Tran, filling in for Sonyi Lopez, and today is Tuesday, December 22nd. Coming up, we'll be speaking with New York State Senator Gustavo Rivera about the microcluster zones in our city and how government officials can help the residents hardest hit by the COVID-19 cases. Then, we will discuss the closing of indoor dining and what this means for restaurant owners in the Bronx with Franz, the Belmont Business Improvement District Treasurer. After that, we'll talk to the president of the New York State Latino Restaurant Bar and Lounge Association, Garcia, to discuss the steps restaurant owners are taking to save the restaurant industry. And we'll take a look at the safety restrictions implemented during the New York City public schools reopenings with ESL teacher Aixa Rodriguez from Caucus and public school parent Michael Beltzer. So please stick around. Open BXRx starts right now. Welcome to Open BXRx on BronxNet. I'm your host, Jericho Tran, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. With the rising number of COVID-19 cases, Governor Andrew Cuomo introduced a microcluster strategy to help address key areas across the state with high infection rates. Each area is categorized into color-coded yellow, orange, and red zones with corresponding levels of restrictions based on their severity. Here to tell us more about these zones and restrictions in each area is New York State Senator Gustavo Rivera. Thank you so much for joining us today. Can you tell me a little bit more about these microcluster zones and their restrictions?
Yes. Thank you for having me on, Mr. Tran. So the goal here is to we have to avert what we saw back in March and April. And we all remember the way that every couple of minutes there will be an ambulance sound on our windows. We need to avert that. And what we need to, this is an attempt to do that. What we do is, what the governor decided to do was based on two measurements in particular, the positivity rate, as well as the hospitalization rate. And also more specifically, the capacity of hospitals in each particular zone. And they tried to do it in a more neighborhood based way, down to the zip code level. Just a couple of days ago, that decision was, it was actually, we went to a citywide zone. We actually expanded the zones, particularly because we saw those numbers creeping up in a very scary way. But the goal here is to, based on those two, on positivity rates as well as hospital capacity, to avert the type of tragedies that we saw back in March and April.
And can you tell us a little bit about your suggestion to declare New York City an orange zone?
Yeah, that was something that we did, and ultimately the governor did take us up on that. But at this point, when this is being recorded, I believe it was 10 days ago, when my colleague in the Assembly, the chair of the Health Committee in the Assembly, Dick Gottfried, as well as the chair of the Health Committee in the City Council, Mark Levine, and the chair of the Hospitals Committee in the City Council, Carlina Rivera, we all wrote a statement that we put out kind of as a public letter saying that we believe that at that time, the numbers were pretty clear, that we're going in a direction that we needed to be really careful with. And so we called at that time for indoor dining to be shut down, as well as for places like gyms and other businesses of that type to be shut down. And let me be very clear about this. It's not that we do not understand the impact that all of these closings and changes have had on small businesses. We care deeply about that, which is why we're working to try to provide benefits for small businesses, both at the state and the city level. But ultimately, this is about averting what, we're in the middle of a public health emergency, and it's to be able to avert the type of things that we saw back months ago. We don't want to go back there.
And now Governor Cuomo attributed 74% of the new COVID-19 cases to private household, within the household. What are your thoughts on the origin of these new cases? And do you think this number could increase with stronger restrictions?
I mean, the hope is that stronger restrictions do that. I mean, I think we certainly lost a lot of time at the beginning of the pandemic, but eventually we saw, we all know if you asked us we asked anybody in February what flattening the curve is, probably most folks wouldn't have been able to tell you what it is. And now most folks know that that means like making sure that there's enough, few enough cases so that we don't have the overwhelming number of people going to hospitals. And so what we're trying to do with these restrictions is to try to get people in that mentality again. We have to flatten the curve. At this moment, the way that these new cases are showing up, and the people that are showing up in hospitals, we're in a trajectory that we cannot keep up. So our hope is that these restrictions would actually have an impact on private gatherings as well. It is risky, and I know that after a very tough year, during the holidays, what most people want to do is get together with family and friends and just kind of, have a relaxing drink or a relaxing dinner. That is too risky at this point, and we want to make sure that people understand that.
And how can the city ensure household gatherings are limited to 10 people maximum during the holiday season? Will there be consequences if the test and trace team links a cluster of cases to specific gatherings?
I don't think, that certainly I would not be supportive of things like, this is not a crime, but we're trying to do to folks just so that they are aware of the risk that they're putting themselves, their family members, their neighbors, and their communities in. So I think that the goal here is to try to educate people as much as possible, to make sure that they understand what it is, why it is that it is important to kind of avert what we saw back in March and April. And certainly, sternly tell folks, be smart. If you care about your family members, if you care about your neighbors, if you care about your community, just be safe, wear a mask, have social distancing, maintain the type of gatherings to a bare minimum, because we need to make sure that we flatten that curve, that we do not go back to where we were so many months ago.
And do you believe that the shutdown of indoor dining will help flatten the curve, even though beauty salons, gyms, they all still remain open?
Well, I'm actually calling for that. I believe that obviously restaurants by default, the way that it works is that when you have dinner with someone, you're sitting in the same table, and we're in an enclosed space. So we feel that presents higher risk than either, salons or gyms. But I would actually say that the numbers might be at this point enough for us to even go in that direction and say that we needed to shut them down as well. And look, one more time, it is not that we do not understand that there are impacts to small businesses. There are many rescue packages that we're hoping that the federal government approves once we have the next administration in power. And we're talking to our governor right now in the state legislature. We're talking to Governor Cuomo about making sure that that we create some sort of support structure for small businesses. But at the end of the day, we need to make sure that that we protect people from the worst aspects of this. And to do that, we need to limit the amount of folks that get together so that we can limit spread.
And with the introduction of the vaccine, do you think that some of the restrictions on these zones will change?
Eventually, but not yet. Everyone has to remember that this disease has an incubation period. The incubation period has been, different studies have shown us it's between 4 and 7 days, but that might mean that that's why you have asymptomatic people, right? People that carry the disease can spread the disease, but are showing no symptoms. So everything that we're seeing as far as data right now, hospitalization rates, testing rates, all of that is lagging, right? So all of that is, if we have an incubation period of 4 to 7 days, and all the data that you're seeing is of infections that happened a week ago, 4 to 7 days ago, right? So in the same way, now we're starting with vaccinations, which is an incredible feat. We need to understand that it was done in a very short period of time, that the science is there. I believe that it is important to take the vaccine, but the distribution of it is going to take some time. First of all, you have to create, there's a series of guidelines that are followed for distribution. One of them is healthcare workers are the front lines. They absolutely are the first ones who should receive it. Folks in nursing homes and other facilities that, they can't go anywhere and they're kind of like congregate facilities need to receive them as well, which means that the restrictions that we're talking about, which impact people like you and myself who are, we're not healthcare workers and we're mobile, so it's going to impact us. The restrictions need to continue to be in place for folks like ourselves until we can get a hold of this. So the vaccination process has begun, and that is excellent. That is hope at the end, kind of light at the end of the tunnel, but we're not done by a long shot.
The governor introduced a surge and flex plan for hospitals that was briefly implemented in the spring and plans to use it again during the winter. Is there a possibility that shifting the COVID-19 patient load will affect microcluster zones?
I mean, this was something that was implemented by the governor in the middle of the pandemic to kind of make sure. I mean, everybody remembers the pictures about what happened at Elmhurst Hospital out in Queens. You had it's a public hospital that was overpopulated. There were so many folks there, so many cases, while they were hospitals that were mere miles away that had barely full emergency rooms. So we created a system in the state to be able to kind of flex, if you will, to be able to understand what the capacity is in the system as a whole and be able to say, well, this is getting a little bit overburdened over here. So let's actually switch up some patients, even though geographically this might be the place where they would usually go. Let's actually redirect them over here so that this is not overburdened. And so I do think, I'm hoping that such a thing is not necessary, because when that happens, it means that we have so many people that are hospitalized that we need to put this into effect to be like, this particular facility is overburdened, so we need to go someplace else. Whenever we reach that moment, we're in a bad place. So I am glad that the system is in place so that we can do that if necessary. But again, the restrictions that we're talking about, the pleading with people to make sure that we wear masks, that we continue to respect social distancing rules and other public health guidelines to be able to protect ourselves and each other. That's why we're repeating it over and over again, because we do not want to get to the point where we were in March and April. I cannot say that enough. Too many of our brothers and sisters, our mothers and fathers, our neighbors died, and we can avert that if we take action right now to make sure that happens.
All right, and we're running short on time, but really quick, I just want to ask you, during the first wave, residents from several areas in the Bronx were hit the hardest. And as the city battles a surge in COVID-19 cases, what are you currently working on to help residents recover from a possible second wave?
So one of the things that we're doing is we're doing things like this to make sure to keep people informed about what they need to do to make sure that we do not have that second wave. But there's a bunch of pieces of legislation which I have introduced along with my colleagues to deal with some of the issues that have popped up because of COVID. There's a bill that I have which protects folks from medical debt. We've already seen people who have been in incredibly dire situations because of medical debt that was a product of them being treated for COVID. We want to make sure that we can protect them. We want to expand coverage to immigrant New Yorkers during COVID-19. We want to make sure that we have safeguards for home care workers during this period of time, and we have bills, a series of bills related to the impact of COVID-19 on nursing homes and hospitals. So legislatively, I'm doing what I can to put pieces of legislation forward that will help us avert unnecessary deaths. I'm right now making sure that we tell people the things that they have to do individually to protect each other and to protect our communities. And above all, I'm asking the governor to make sure that we go back to Albany so that we can raise taxes on millionaires and billionaires so that we have more resources to be able to avert the cuts that he is proposing to all sorts of programs that work for our most vulnerable. So all of those things I'm doing along with my colleagues, and I'm hoping that we have some good results.
Well, Senator Rivera, thank you so much for your time. We will be right back.
coronavirus spreading, people at higher risk must take extra precautions. You're at higher risk if you're over 65 or if you have an underlying medical condition. Please visit coronavirus.gov for more information.
Welcome back. Governor Cuomo recently announced the close of indoor dining within New York City. With the recent restrictions, restaurant owners have struggled to stay open, and they fear what the winter will do to their businesses. Joining us now to discuss is the Belmont Business Improvement District Treasurer, Franz. Frank, thank you so much for joining us. Can you tell me a little bit about the Belmont Business Improvement District?
Oh, we're one of many business improvement districts in the city that are organized by the merchants of this community to turn around and promote the economic development of the area. So here we represent the historic Little Italy district centered at Arthur Avenue and 187th Street. And we do our best to, keep business lively and just create opportunities, both in employment and business for people who want to invest up here.
So let's discuss the new restrictions on restaurants and bars. What are business owners being told they have to do now, and how are they feeling about it?
Well, the restaurants have to close down all indoor dining, which, as it was only at 25% to begin with. As a former restaurant owner myself, I could tell you that restaurants do not make money at 25% to begin with. Most of our restaurateurs, many of whom have been here for decades, in some cases century, reopened with the outdoor dining and the 25% indoor capacity, knowing that they weren't going to make anything, but just want to keep their employees, give them a paycheck, feed their families, and keep them employed. The loss of this 25% of indoor dining is going to put everybody in the red. And on top of that, the outdoor component is not really feasible going into cold weather. I was just out today myself to join somebody for a cup of coffee. We couldn't sit outside, for 2 minutes. We got in my car to have the meeting. Several of our businesses have already taken in their outdoor dining stands because they're just not going to do it. And most of the others are not in use at present, and I doubt if they will be. We're still at the beginning of the winter.
Now, Arthur Avenue is home to Bronx's Little Italy section in the Belmont section of the Bronx. Can you tell us how some of those restaurant owners in particular are feeling about this shutdown, especially since outdoor dining is going to have to shut down because of the weather?
They're frustrated and irate. It seems that this segment, we're all being hit with what's going on nowadays. So I don't want to turn around and give the impression that restaurant owners are the only people affected, but they are among the groups that are most severely affected, have been for a long time. And they employ in New York hundreds of thousands of people, many of whom are at the lower, income levels. So it impacts their lives even more. And when we turn around and look at the statistics, for the last year, I've been hearing people say, follow the science, follow the science. Well, from what I understand, 74% of infections are coming about from personal contact with people and at home. Restaurants are among the lowest percentage at 1.4%. That's restaurant and bars. When you turn around and take the bars out of it and people drinking and just come down to restaurants, it's actually even much lower. And since it's one of the lowest areas of where this illness is spreading, I don't see why they are taking the brunt of the economic hardship.
And, Frank, as the treasurer, please tell us how businesses in the Belmont district performed before the pandemic and how much this performance has dropped during the last 9 months.
Well, before the pandemic, you couldn't get in a restaurant on the weekend. We're a weekend neighborhood. 83.5% of our business comes from an area 5 miles away, not from the Bronx, but from Westchester, Connecticut, et cetera. So Friday night, Saturday, Sunday, the neighborhood is packed, and that's when people make their money, not so much during the week. So when you turn around and limit things to 25%, it's not a matter if it's a 25% all week. During the week, you might not be doing 25%. But on the weekend, when you're making your profit, 75% of that has been pulled away, and now 100% of it has. The neighborhood was quite busy. We had new business. We still have a few new businesses that have opened, trying to weather the storm because they know the potential of our community.
And what do you think it's going to take to recover from this?
Obviously, once the vaccine is out and restrictions are removed, I think our community will come back very quickly because we have a very dedicated group of people who patronize our neighborhood. So, but as far as the rest of the city, I think we have a real problem. There are many businesses, restaurants, hotels, and other businesses that have permanently closed. They're not going to pop back up. We used to get tens of millions of visitors a year. That's not going to come back right away. So that's going to have a downward pressure on all types of entertaining, hospitality, food industry things. You know, the city and state budget is in a crisis already, and this is going to cost a fortune in tax revenues. So I think the city and state has a long period ahead of them to try and get back to normal. And I don't know if it will unless there's the right, you know, political and business desire to make that happen.
If you could contact Cuomo, you know, what would you suggest to him to move forward with regulations in the restaurant industry?
Well, the first thing is I think you should talk to more people who are restaurateurs and not necessarily, you know, the big chains or the well-known celebrity chefs, but all the little mom and pop restaurants that constitute the majority of it out there and get the firsthand information. Secondly, I think he should look at his own data, you know, to see that these moves aren't warranted. I believe we have one of the lowest infection rates in the country. Our schools have virtually none. And what adds insult to industry is that, to injury, is that we're closing down in New York, where I live in the Bronx. In 4 minutes, literally, I could be in Westchester and eat indoors. So, I mean, you know, what is it about New York restaurants that are, you know, causing this virus to spread? Well, obviously, that is not the case. Even before this, restrictions like closing at 10 o'clock at night. I really couldn't understand that. I mean, is there any scientific proof to show the virus spreads faster late at night than during the day? It's really sort of ludicrous. Or the fact that you can't sit down at a table and have drinks. You have to eat. If 4 people are sitting at a table, I think whether they're having a bowl of soup or having a cocktail will not turn around and affect the spread of this virus. So there's actually quite a few rules that we in the industry and we in our community just don't understand where they came from. And if there is some real justification for this, we'd like to see it, but we can't find it anywhere. And we've asked, and no one has supplied us with any information to justify what has been going on for quite some time, let alone what is happening now.
And can you tell us a little bit about, you know, the rules that exist for outdoor dining as far as eating, spacing, all of that?
Okay, well, if you were to continue the outdoor dining, for one thing, you can't have an enclosed tent outside. At least 2 sides have to be open, which means you'll never get it warm enough. I mean, when it goes down, you know, New York winters, when it's 10, 20 degrees, I mean, today it's almost 40 and it's still too cold to be out there. Either it's going to be ice cold or you're going to be running heaters so hot that it's going to be too hot. And going from hot to cold is not good in the middle of the winter, let alone the people waiting on the tables are going to be going from inside a warm restaurant outside into freezing weather, into a warm tent, back and forth. It's not good for the employees either.
What happens if businesses do not abide by restrictions? I know I spoke to a couple of business owners over the past couple of weeks, and they tell me that they've been visited by the city multiple times. And when they do get those visits, it's multiple times in 1 week, and they're all saying different things. So what happens when, you know, they don't think they meet the restrictions?
Well, you know, as far as I could see right now, all our restaurateurs in our neighborhood are obeying the rules. We had that problem when this first started. The city was changing the rules every other day. And we had inspectors coming through every other day from DOT and other agencies, everyone telling somebody to do something different. So a guy does it one way, next inspector comes, says that's the wrong way, change it back. All this, you know, costing a lot of money and taking time. And there's been no clear direction from the beginning in this entire issue, which is why I'm fairly convinced that many restaurants in the city are just going to close down now without the 25% inside. When they allowed the outdoor dining, that was not profitable, but a lot of people started it, seeing it as the road back to recovery. Then they got the 25% indoors. All right, now they're paying the bills. Now they're looking for the 50% so that maybe the owner could put a few dollars in his pocket or more. Now that we've taken a giant step back in removing that 25%, and we're heading into the winter and a questionable future for outdoor dining, I think most restaurants are going to close down. It's just not worth it to stay open. They'll be losing money every month. It's one thing not open. It's another thing taking money out of your pocket, you know, every month. And it's just not a viable economic situation for most restaurants.
And Frank, thank you so much for your time. Is there anything else that you wanted to add?
Well, simply, I hope this is over with as soon as possible. That's all I could say. And I'm sure I'm not the only person in the country that feels that way.
Yes, definitely. Well, thank you so much for your time. We will be right back.
Save our job! Save our job!
Restaurant owners and workers rallied in Times Square in response to Governor Cuomo's new ban for the second time on indoor dining that went into effect on December 14th.
Why Cuomo at this time of the year? Why? We have another problem.
The industry that normally employs 300,000 here in New York City went down to 90,000 after the pandemic. When indoor dining reopened, they were able to add 100,000 to that number, and they fear now turning this group away will further destabilize communities.
2/3 of New York restaurants said they're likely to close by the end of the year. Without a comprehensive relief package by our government,
we need Senator McConnell, Rubio, and the federal government to enact the Restaurants Act. It is a revitalization fund to help pay for rent, payroll, vendors.
This is my livelihood. This is how I support my child. I have a 3-year-old.
And Gloria Faye is just one of these workers. She works at Mama Sushi's on East Tremont Avenue, and she's showing us a picture of her 3-year-old son.
This is our work. This is what we survive out of. So same way I go to work every day, same way I have to come in to support because we need to open back up.
Susana Osorio is the owner of Mama Sushi's and 10 other restaurants that employ 206 people. She says this plan will hurt her business.
What makes you think that the restaurant, we are 2 hours with a 2-hour seating, with a 25% in closing at 10 o'clock? We are another problem.
And City Council member Fernando Cabrera, who is agreeing with her, is urging the governor to look at the data.
Only 1.3% of all the cases of people who have contracted COVID happen in restaurants, which is actually lower than what you find in most scenarios that people find themselves in. They're targeting a group of business owners and restaurant workers that are going to pay a tremendous price for something that they're really not the cause and the root of the problem.
Meanwhile, this is what the governor is saying.
that is not the real problem. That is not what you should worry about. What you should worry about is shutdown. Because if we do not change the trajectory, we could very well be headed to shutdown.
The event concluded with a march from Times Square to the governor's office on 3rd Avenue.
While plans for a total shutdown are not immediate, City Councilman Cabrera says that the governor's office will be monitoring these restaurants over the next couple of weeks. For BronxNet, this is Arlene Makoko.
Welcome back. With the close of indoor dining, restaurant owners are rallying to save the restaurant industry, asking for funding, rent relief, and PPE, while also questioning why indoor dining is shutting down when, according to Governor Cuomo, they only account for 1.43% of the new COVID-19 cases. Here to tell us more about this effort is Jeffrey Garcia, president of the New York State Latino Restaurant Bar and Lounge Association. Jeffrey, thank you so much for being here with us today.
Hi, Jericho. Thank you for having me.
Of course. Can you tell us a little bit more about the New York State Latino Restaurant Bar and Lounge Association, please?
Hi, it was an association basically started back in 2016, and it was to advocate for Latino restaurant owners and bar and lounges who really didn't have a voice, and many things that were going on throughout the city at the time. And one of the bills that we were working on at that time was the hookah bill, which then passed and basically made hookah. You needed a permit for hookah inside restaurants. So since then, we've been dealing with many issues going on in the industry, and then now we have this pandemic that has obviously affected not just this industry but all. However, it feels that this industry has really put the COVID and this pandemic on its back because we're the first ones to feel it. And we had a huge rally in Times Square where over 1,000 members, customers, industry leaders, and elected officials showed up to advocate for us because we are hurting right now.
And Jeffrey, describe the scene for me at that rally.
It was lively. People just, one of the chants that got to me the most was, we want to work. Like basically owners and employees just want to get back to work at some capacity, at least the capacity we're at, or our counterparts in Long Island and Westchester. Westchester and Long Island, you can eat at 50% inside. Even right now, even today, as we're close here in New York City, you can go to a restaurant in Long Island or Westchester and eat inside. And that is unfortunate because the density inside a restaurant is the same anywhere in the world, unless there is something that we don't know about, that the governor's just not telling us, that the air is better in Long Island and Westchester, and that we're not aware of.
You were quoted saying that the shutting down of indoor dining during the holidays when New York City restaurants are providing safety measures is the straw that broke the camel's back. Describe for me what you mean.
Absolutely. I mean, this is going to be devastating for many of these owners. They were already living on very thin margins and already had topped out loans. They have already used up the PPP that they had gotten. They had already used up the SBA loans that they have gotten. They really can't borrow any more money. And even with all that, why? Because in addition to getting back to business and getting back to work, the city, because they allowed us to do outdoor dining, we had to spend a lot of money building structures and devices to be able to, do outdoor dining. Then they tell us for indoor dining, you're gonna have to do these guidelines. PPE, you're gonna have to do things with your air filtration systems. You're gonna have to invest in dividers. You can only have a certain percentage of people. So all those investments cost money. They didn't give us money for that. As a matter of fact, the PPP that we got, 60% of it was supposed to be used for employees. And that's great and wonderful. But what happens to us now? There is no anything going on in Congress to pass the Restaurant Act, which would be specific, about $120 billion specific just for restaurants. And you know what? That would go a long way. If you're making us shut down, then you should be helping us. But again, folks just want to get back to work. We feel we should be open at least to the level of our counterparts and be able to work.
And do you think that you will have to do more rallies to really get your point across?
Well, I don't know if the effect was that quick, but as I was driving back from the rally, I heard that Mitch McConnell said that they're not leaving DC until they have a COVID bill. Did they hear our voice? I hope they heard our voice. I hope Governor Cuomo heard our voice. I hope he advocates for us and the states for us to get that bill passed, because we need the funds. So you know what? We've been doing our job. We've been following the rules. Then you know what? They need to do their job and get us help.
And how has the association helped or provided resources, services, and information to business owners during this pandemic?
Well, through the efforts of the association, we were able to push for the second round of PPP through our local congressman, Adriano Espaillat. He was a great advocate for our association and our industry. So when we got the second round of PPP funding, we were able to work with Bonse Bank in the Bronx to get a lot of our members on board and help them receive those funds of PPP that they were most definitely entitled to during the first round, which they never got.
If the New York State Latino Restaurant Bar and Lounge Association could pitch and suggest alternatives to business practices that will benefit business owners and protect their patrons, what would these alternatives be?
Maybe what the governor should do is bring us to the table and see what mitigating things can we do to further, aside, because the rules that they had in place actually worked. I mean, 1.4%, like you said, is the infection rate inside indoor dining. So that means the protocols that they had in place worked. Now, do they want to bring it down to zero? Do we want to mitigate that even more? Do we want to help out even more? Yes. Well, what do we need to do? Maybe go to single-use cups, single-use silverware or plasticware. Do some more disinfecting. Do some additional cleaning. One of the things I think that would be great as well is working with local healthcare providers to do testing for employees on a weekly basis. So all these little things that I feel can go a long way. Because if 74% of all infections are happening indoors and in clandestine gatherings or at home, then why not get people out more? The mayor says he's going to start taking the train. He's advocating for people to take the train just to work and then go back into their, huddle at home with 20, 30 people and have parties at home. No, if they're out, at least when you're out, you're following certain amount of protocols, wearing masks, temperature checks, 6 feet distance. The location is cleaning bathrooms and areas every 20, 30 minutes. These are things that you don't normally do at home. And if you invite people over, chances are you're not wearing a mask at home or anyone else. So I think that obviously getting people out is a good thing, but getting people out safely. And I think that we've been doing that and we have accomplished that.
So, we're taping this today, December 15th. This is going to air on December 22nd. Do you have a deadline for your demands that you would like to be met before then or after that?
Well, yesterday, we should have been open back up yesterday. We should, at the very least, then open back up today. So it's not a demand. I think that he just needs to sit with us and be like, okay, how is it that we can help you guys? What is that we can do to, stop this spread? What is it that maybe you need to understand? Maybe he hasn't told us all the facts. Maybe he hasn't told us everything. But based on his own numbers, 1.4% is just not acceptable. And again, why is it acceptable to be open in Westchester and in Long Island, but not in New York City? Inside a restaurant, 10 people is 10 people, whether you're here or anywhere else in the world. If you want to talk about density, maybe I could have understood density in the summer months where there was so many people walking around the streets. But right now, with the weather the way it is, who's walking around the street? What density? There is no density. I saw just the same amount of people coming out of a restaurant in Westchester as I did in New York City. I've seen it, the same amount of people walking out. There's restaurants in Long Island, they're in mall areas that tons of people are walking around. So you know what? I just think it's a little unfair to categorize this that way.
Now, the New York State Restaurant Association released a report saying that by the end of the year, 2/3 of restaurants are likely to close. How do you think we recover from this?
I don't think we recover from that. Where are you going to get the funds to help those people come back? What are you going to do with all those workers? The hospitality industry employs over 300,000 employees in New York City. More than half of our out of work right now. I know employers right now in our association who have up to 130 employees. They just let 100 of them go because they don't need that manpower right now. What do you do with those folks? If that restaurant can't come back, what do you do with those 130 people? It's not like they just go to the next restaurant. I had a former employee of mine call me that the restaurant he went to go work to, oh, the hours aren't there. Can I come back? Do you have some hours there? I said, no, I don't have hours either. You know what I mean? Like if he didn't have hours, I don't have hours. So do you see the despair that these employees are going through, especially now during the holidays, that they don't know how they're going to feed their kids? They don't know how they're going to put maybe a gift that they were promised throughout the year if they were good. So it's very difficult times right now.
And please leave us with a message on how people can continue to support the New York State Latino Bar and Lounge Association. Well,
obviously, we got to do what we got to make do what we have. Visit your local restaurants, order takeout, pick up food to go. We really need that. And then once we open up, really talk about how safe your local restaurant is. They talk about the herd immunity thing. At least tell people, how about stay local, shop local, go to your local restaurants. You know why? Because that's the community where you're in. So if you're there, if you're not traveling, one, you're not taking the train, right? So, chances are you have less contact with people and usually walking to and from the place where you're going to go eat. So why don't we encourage that? Eating and shopping local, and maybe that can also help stop the spread. So we definitely encourage folks that the moment we open up is come to our places. Definitely use the social media platform to say how safely they feel and what the restaurant is doing to make sure that the spread of COVID is not happening in their places.
Jeffrey, thank you so much. Once again, we're speaking with Jeffrey Garcia, who is the president of the New York State Latino Restaurant Bar and Lounge Association. Thank you so much for your time. We will be right back.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, they want to be tested.
When things were happening in our community and we couldn't get the help.
There's almost a presumption of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scales of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting
To the new reality.
Reporting from BronxNet, this is Tran.
Who's most at risk for coronavirus? People over 65, people with underlying medical conditions like heart disease, chronic lung disease, asthma, diabetes, people undergoing cancer treatment, and people with weakened immune systems. What should you do if you or a loved one is at higher risk? Avoid close contact with people. Avoid crowds. Stay home if you can. Wash your hands frequently. Learn more ways to protect yourself and others at coronavirus.gov.
Welcome back. Over 850 New York City public schools reopened over the past few weeks with the requirement of weekly random testing for staff and students. About 250 of these schools are participating in 5-day-a-week in-person learning throughout the city, with the mayor planning to systematically shift more schools to in-person learning each week. Joining us now to talk about the reopening of public schools is ESL teacher Aixa from Caucus and public school parent Michael Beltzer. Thank you so much for being here with us, guys. Aixa, I want to start off with you. Can you tell us a little bit about Caucus?
So more is the movement of rank and file educators. We are a caucus, kind of like a political party that organizes around social justice issues within the UFT, which is to say that we are seeing our learning, the working conditions as the learning conditions of the students. So we understand that there is an intersectionality between social justice issues and how it plays out in the public education system.
And Michael, can you tell me a little bit about your experience as a public school parent?
Yeah, so my experience as a public school parent of a 10-year-old daughter has been one that has been one of uncertainty. As a working parent, it's been hard to juggle her new remote learning requirements. And, there's been a lot of, there hasn't been a lot of communication or a plan that parents have been able to follow. So it's something that's been difficult for me and others in my community.
And moving to Aixa, can you tell us about some of the health precautions set up within schools?
Well, different schools have different precautions depending on the age of the building. First off, there are many teachers who are on medical accommodation. So that's one thing that has impacted the schools. The staffing is not the same. So with that staffing comes the whole issue of how many students can be assigned to an in-person teacher, and we're following the CDC guidelines and capping it at a certain time. My understanding is that currently the DOE is trying to up that limit and add a couple of more kids, up to like 14 in a class. And so those of you who went to public schools, if you went to a school that was built before the Great Depression, the sizes, the shapes, the materials, the heating, the ventilation, the windows, all those things are problematic. If you are in a more modern school, you may have the opposite problem where the windows don't open because everything is the HVAC system, which in the Martin Luther King building was a disaster. The whole building had to be shut down and 6 schools had to be relocated. So it depends, but our facilities are a big part of why we want people to pay attention to what we're saying about the conditions of the buildings. Some of these buildings are just literally death traps.
And Michael, what have some of your observations been of the health precautions within schools?
I personally have not been entering public school buildings, so I couldn't tell you directly. I do serve, my community on the Community Education Council. So we have heard a lot of feedback that, people feel like it's moving in the right direction, but there are still some concerns about whether the tests are mandatory and whether the vaccine will be mandatory as well.
And, speaking of the vaccine, how do you think Aixa, for you, are you, optimistic that a vaccine will improve the situation within schools?
I am, and I will take it. I'm very happy that it's finally happening with multiple different companies who have created different vaccines. So we're not dependent on one only, and that we can continue to have, move towards a new normal. Because the reality is that teachers are an essential workforce. We know this, we're not in denial of it, but the situation is we need to be safe. And we have a lot of older teachers, a lot of us have health conditions, and it's a female dominated profession. So you have a situation where a lot of us are mothers, or we are pregnant, or some other circumstances. So the vaccine is super important to get us in front of children. I believe that teachers and educators are 1B or something in the ranking of who's going to get it first, healthcare workers, nursing homes, and that we'll be part of the first few waves of professionals that will get access to the vaccine. And I hope that it becomes mandatory, just like every other vaccine, because I'm an ESL teacher. I work with kids who are in a lot of vulnerable communities who come from all over the world. And the reality is we got to keep each other safe. A lot of these communities suffered very greatly under COVID. Without precautions and without that support, you can have more pockets and outbreaks in communities that have high levels of poverty and not a lot of access to healthcare, and can really have some adverse effects on their population. So I can't wait for this to happen, because there will be a measure of protection that otherwise we won't have. Opening the window for ventilation is not protection. And that's what we're currently doing in these buildings built in the 1930s. So a vaccine, I can't wait for it.
And Michael, you know, with your child, is a mandatory vaccine, is that something that you would be open to?
Well, I believe that my child will get it. I will be getting it. I believe most people are on board with mandatory vaccination. I think the important part to get to is to the 75% threshold. I think they said that's what they need the vaccine to go on. So we really need to make sure that schools are serving as a model for the community. So if we're pushing for vaccinations, we should make sure that the communications are clear to folks, that folks know exactly where they can go to get it. Maybe some schools could serve as hubs for this type of administration. We need to make sure that everything is going out in all the language in each of the community. Schools, again, could take a leadership there because they have whole dedicated arms to reach out to the parents in the community. And, you know, we need to also make sure that it's equitable. You know, I'm glad to hear that teachers are high up in the list because they are essential workers. They're putting their lives on the line. But we know when it comes to getting resources for our community, our Black and Brown communities, is not always equitable. So I think when we move to make it mandatory, we need to make sure that going alongside that is making sure that it's equitable in its distribution and it's not overlooking people who are already at high risk for COVID in general.
Now, Mayor de Blasio is really pushing for in-person learning 5 days a week. And Aixa, just a few days ago, Caucus recently tweeted that 127 of the 878 schools that reopened are now closing down due to COVID cases. Do you think that this is going to be a viable plan to have schools move back to this 5 day a week in-person learning?
You know, everybody has goals. I respect that de Blasio is trying, but let's be real. None of the problems were solved. So pushing towards 5 is ridiculous. And from the parent allies that we have, what we've been told is this push for 5 days is ignoring the majority of students, 700K plus, who are remote. And it's pushing for more active days of blended learning or hybrid learning for the kids who are there, the majority of which right now come from populations that are privileged, the majority, or people who have no real choice. But there's the vast majority of all students are being kept home at remote. And why? Because it was less disorganized. The kids got more attention 5 days a week, had consistency, and in some cases were ahead in the curriculum than the kids who had 2 days a week in person, 3 days remote, and got juggled between different classes and teachers all over the place. It's been absolute chaos. So I can understand why he's going towards 5 days a week, because hybrid has been an absolute fail. But because we're seeing an exponential growth of COVID cases coming post-Thanksgiving and going from 5 a few days ago all the way to 127 yesterday, I think it's not logical. It doesn't follow basic math. It doesn't follow the science. And we have been saying forever, keep us remote till January, fix all the problems. There's over 60,000 students who still have not received the proper tech. And there've been lots of glitches reported with the iPads that many parents are dissatisfied with, and all of these other things that are making parents' life very difficult. So it's one thing to want and to have a goal and aspire to something. It's quite another to be like, let's solve the problem so that we can do this. It seems like he wants to build a plane while flying it. And it's not a wise situation. We're going to have Christmas coming up soon. You can't tell people not to travel. There were several of my students whose parents couldn't find like any place to watch them, sent them to their grandparents in DR. So they were staying over there. And so they technically were logging on from another country to go to school. So the reality is childcare has been an issue. So I respect that. Childcare definitely has been an issue. Learning Bridges has been a godsend for some, and people who didn't get access were kind of frustrated with it. 5 days a week is ambitious, and I understand that. But can we solve the problems first? Can we make sure that the kids have tech? Can we make sure that the teachers are trained? And can we really have a conversation about what we're trying to get out of the kids in a remote setting with a short amount of time? Because the kids are being bombarded with a lot of work because the teachers are being pressured to be rigorous, and then everybody's unhappy. So he needs to solve his problems first instead of creating more.
And Michael, as a parent, have you experienced experienced difficulties with remote learning as far as, technical issues, and has your school addressed this?
Fortunately, my daughter has access to a device. I know a lot of other kids have not. The school has been able to adjust it as much as the Department of Education has allowed. Getting the hands on the devices. What I've seen is, what Aixa was talking about was the juggling of the staff. My daughter, it was just a traumatizing experience to go through, hearing her teacher say, "This is the last day I'm going to be able to teach you today," and hearing all the kids cry on the call because they had connected with this teacher, because they were shifting things around to do in-person learning, and it was just a last-minute change. So I think that's been a challenge, is the consistency, and again, throughout the process. And but in some ways there has been some good things coming out of remote learning. I really appreciate both our teachers have done social emotional learning, which is something that needs to make its way back into the classroom if they do full-time learning. And I think there's some lessons that we can be learning from things like that, in the way that they're able to structure some of the time with the remote learning that can help in-person learning when it returns.
Thank you guys so much for your time. I truly appreciate it. That is all for our show today. Thank you for tuning in to BXRx. I'm your host, Jericho Tran, wishing you a safe and happy holiday season.